I actually use the microphone. Good morning, everyone. I'm going to call to order the Joint Subcommittee on Human Services, and we have 20 things to get through this morning, and we are just going to roll right through this. So if we can just start, and I will turn this over to staff to begin the budget closing process. Roll. Gosh, every time, guys. Can we call roll?
Assemblywoman Anderson. Assemblywoman Dickman. Assemblyman Hafen. Assemblywoman Howdigi. Here. Assemblywoman Monroe Moreno. Assemblyman Watts. Here. Assemblyman Yeager. Here. Senator Canizaro. Senator Dondero Loop. Here. Senator Severs Gansert. Senator Titus. Assemblywoman Gorlow. Here. Chair Nguyen.
Here. And for the record, if we can mark Senator Canizaro absent, excused, and Senator Titus or anyone else as they walk in, mark them present as they arrive. And with this, now we will get started. How about that?
Thank you, Madam Chair. Tiffany Greenmeyer, Program Analyst for the Fiscal Analysis Division for the record. There are 20 budgets to close today for the Division of Public and Behavioral Health. 8 of the budgets are staff closings that the subcommittee has not previously heard, and these are the 8 budgets for staff closing are towards the end of the packet. So moving on to page 3 is the child care service budget, which is budget account 3149. There are 2 major closing items in this budget. The first one is 5 new full-time facility surveyor positions. The governor recommends $809,275 in federal child care and development block grant funds transferred from the Division of Welfare and Supportive Services over the 23-25 biennium to support the addition of 5 new full-time positions and associated costs. Including in this budget that there are the 4 child care facility surveyor positions, which will complete annual and semi-annual follow-up and drop-in inspections of child care facilities to ensure compliance with federal regulations. 3 of the positions would be located in southern Nevada, and 1 would be located in northern Nevada. Moving on to page 4 is the 1 facility surveyor position, which is a supervisor. This supervisor will be located in northern Nevada, and will provide supervision, training, evaluation, and of the performance of the child care facility surveyors. Just to let you know that currently the budget supports 2 supervisor positions which are housed down southern Nevada. The division DPBH provided workload statistics that the child care service program monitors and or inspects is 476 out of school recreation program facilities and 446 licensed facility sites for a total of 922 facility sites. The agency indicated this program covers all counties within Nevada except Washoe County. During the hearing, the agency provided workload statistics to demonstrate the need for the additional 4 child care surveyor positions. According to the agency, workload statistics are based on the number of complaints filed from January 1st to 2022 through December 31st, 2022. During that period, the agency received 629 complaints. Of those, 220 are awaiting investigations and would require 8,595 hours to complete at 39.1 hours per investigation. According to the agency, the additional positions would allow for the elimination of the complaint investigation backlog by the end of 2023-25 biennium. The decision before you is on page 4. The decision for the subcommittee. Does the subcommittee wish to recommend approval of federal child care development block grant funding transferred from the Division of Welfare and Supportive Services totaling $354,375 in fiscal year 2024 and $454,900 in fiscal year 2025 to support the addition of the 4 child care facility surveyor positions and 1 child care facility surveyor supervisor position and associated expenditures as recommended by the governor.
Do I have a motion?
Thank you, Madam Chair. Apologize, I was late. I have a question regarding the backlog on complaints. I've had some folks reach out to me about that. I'm just wondering how big of a backlog, what's the time frame when there's a complaint?
And I'm seeing if we have anyone from DWSS that might be able to answer some of those questions.
Cody Finney for the record from Division of Public and Behavioral Health. We're currently overseeing this program in the Bureau of Healthcare Quality and Compliance. If I might clarify the question, Chair.
So it says here that was just spoken about background checks, inspections, investigations, and concurrent and on current and new facilities, as well as support to address current complaint backlogs. So I'm wondering how long that backlog is, how many there are, and will this, obviously you stated this will help lower those. So what's the time span?
Thank you, Cody Finney for the record. My understanding of that is current backlog related to primarily background checks, not so much complaints. This absolutely will help them move faster on really all the inspections and the background checks as they transfer over to DWIS as well, assuming all this is approved. And I do not have at the right with me today the amount of time that the background checks are taking. Some of them do have to come from out of state, and those are more challenging for us, but the program has implemented a process to allow folks to work with supervision while they're doing those background checks to mitigate the impact of having that take longer.
And if I might, Madam Chair, sorry, that's different. What I'm hearing is not background check complaints, but complaints about the facility.
Lisa Sherrick for the record, Administrator. So I have data from February, so it's not as of today, which we could try to provide that today if that's helpful. But we had 220 complaints open from 2022. All have been assigned in pending investigation completion for closure. But if you want more specific details, we would have to follow up the program and get that to you this morning.
And if it's okay with you, Madam Chair, I would appreciate that information. Thank you. And thank you,
No,
Madam
that's
Chair.
fine. Do we have any other further discussion or questions regarding this budget? Okay, now I will accept a motion.
Chair, I motion to approve all items as read by staff.
And I'll second that.
Any other further discussion? All those in favor say aye. Aye. Any opposed say nay. Okay, motion carries.
Thank you, Madam Chair. Tiffany Greenmeyer for the record. Moving down on the bottom of page 4 is the second major item in this budget, transfer of the child care service budget. The governor recommends the administrative transfer of the child care service budget from the Division of Public and Behavioral Health to the Division of Welfare and Supportive Services. Moving on to page 5, This would be a cost-neutral transfer of the child care service budget to the Division of Welfare and Supportive Services to consolidate all child care related programs under one division. The governor also submitted a bill draft request to make the necessary statutory changes, which, if approved, would transfer the child care service budget and the statutory responsibility for the licensing and regulations of the child care facilities not otherwise exempt or licensed by local government to the Division of Welfare and Supportive Services. During the hearing, the agency testified the impact of the transition to providers would be minimal, as the agency would have regular communication and training with the providers, post the changes on the child care licensing website, provide notifications through email listserv. Additionally, the agency indicated the individual staff members operating the program with whom the providers have regular contact would not change. Also, the Division of Welfare and Supportive Services confirmed no additional administrative expenditures as a result of the transfer would happen. So towards the middle of page 5 is the decision for the subcommittee. Does the subcommittee wish to recommend approval of the administrative transfer of the child care services budget from the Division of Public and Behavioral Health to the Division of Welfare and Supportive Services, contingent upon passage and approval of enabling legislation?
Do you have any further discussion or questions about this? Seeing none, I will accept a motion.
A motion that we accept the transfer as read by staff.
Second that?
Any other further discussion on the motion? All those in favor say aye. Aye. Any opposed say nay. Motion passes unanimously.
Moving on to, at the bottom of page 5 is other closing items 1 through 3. Fiscal staff recommends other closing items 1 through 3 be closed as recommended by the governor and requests authority to make technical adjustments as necessary.
Do you have another motion on that?
I motion to close items 1 through 3 as read by staff.
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Any opposed say nay. Motion carries. We can move on to account 3153.
Tiffany Greenmeyer for the record. The next budget starts on page 7, which is Nevada Central Cancer Registry, budget account 3153. This budget has one major issue, and it's over budgeting of issuance and renewal fee revenue. The governor recommends budget $284,967 in both fiscal year 2024 and 2025 in issuance and renewal fee revenue, the authority for which was approved by the 2021 legislature in AB 471 to support the Nevada Central Cancer Registry, including 2 existing but vacant full-time health program specialist positions and associated operating costs for the Nevada Central Cancer Registry. The agency indicated that on December 29, 2022, the regulations pertaining to AB 471 were filed with the Secretary of State, which allows the agency to start assessing and collecting a fee of 6% of the issuance renewal fees. Moving on to page 8. During the February 15, 2023 hearing, the agency provided updates related to the issuance and renewal revenue projections. According to the agency, the current projections for the issue and renewal fee revenue in fiscal year 2024 are $233,819 and $248,819 in fiscal year 25, which represents a reduction relative to the governor's recommended budget of $51,148 in fiscal year 2024 and $36,148 in fiscal year 2025. Fiscal staff recommends a technical adjustment of $51,148 in fiscal year 2024 and $36,148 in fiscal year 2025 to reduce issuance and renewal fee revenue to align with the agency's updated projections with an equal reduction to reserves, as shown in the adjustment section at the end of this document. Additionally, the agency indicated they would hire one permanent cancer registry specialist position starting in April of 2023, which would reduce the need for the contractual expenditures over the 23-25 biennium. As a result, the agency requested a technical adjustment to remove $91,468 in the contractual expenditures each year of the 23-25 biennium. Fiscal staff recommends a technical adjustment of the $91,468 in each year of the 2023-25 biennium, as requested by the agency, to reduce the contractual expenditure authority with an equal increase to reserves, as shown in the adjustment section at the end of this document. If both technical adjustments as recommended are approved, the agency would maintain a reserve balance of $109,448 in fiscal year 2024 and $128,058 in fiscal year 2025. Down the decision for the subcommittee would be, does the subcommittee wish to recommend approval of the technical adjustments as recommended to A, reduce issuance and renewal fee revenues by $51,148 in fiscal year 2024 and $36,148 in fiscal year 2025 to align revenues with the updated agency's projections, and B, reduce contractual expenditure authority by $182,936 over the 2023-25 biennium, which would not be needed due to the hiring of a permanent state position.
Any questions regarding that recommendation? I accept a motion. So moved. Do I have a second?
Second.
Any other further discussion? Seeing none, all those in favor say aye. Any opposed, say nay. Motion carries.
Moving on, at the bottom of page 8, other closing items 1 through 5. Closing items 3, 4, and 5 are technical adjustments to align the revenues and expenditures. The fiscal staff recommends other closing items 1 and 2 be closed as recommended by the governor. Other closing items 3 through 5 be closed with the noted technical adjustments and request authority to make other technical adjustments as necessary.
Do I hear a motion?
I motion to approve items 1 and 2 and technical adjustments 3 through 5 as read by staff.
Do I have a second?
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed, say nay. Motion carries. And moving on to the next one, 3190.
Tiffany Greenemeyer for the record. The next budget is on page 11, which is 3190, Health Statistics and Planning. There is one major closing in this budget, and this is the conversion of 4 contract positions to new state full-time position and 1 new full-time position. The governor recommends a reserve reductions totaling $721,983 over the 2023-25 biennium to support personnel and associated operating costs to convert 4 contract positions to new full-time state position and 1 new full-time state position. Moving on to page 12, the governor recommends a decreased revenues in E225 of $109,067 over the 23-25 biennium to support 1 full-time accounting assistant position and associated costs to provide fiscal support. The other position is a administrative assistant position in E226. The governor recommends a decrease in revenues of $115,698 over the 2023 biennium, 25 biennium to support one new full-time administrative assistant. This position is needed to assist in processing the Nevada Department of Corrections requests for offenders' birth certificates prior to their release. And then there are the next one is 3 new management analyst positions, which is E227, E228, and E229. The governor recommends a decrease in reserves of $497,218 over the 23-25 biennium to support 3 new full-time management analysts positions and associated costs to provide administrative support due to the increase in workload. Moving on down towards the bottom of page 12, during the hearing, the subcommittee inquired about the rationale for converting contract positions to permanent state positions. The agency testified that identified contract positions have been contracted since 2018, and the incumbents could be converted to permanent state positions based on the long-term need. The agency confirmed the need to eliminate the associated contract expenditures. So with that, fiscal staff recommends the following technical adjustment to reduce contract position expenditures, which would offset the costs for the recommended full-time positions for Decision Unit E225, E226, and E227, and E228, totaling $382,848 over the 2023-25 biennium. And that's just right below that is the amounts for the individual decision units. So moving on with the consideration of the recommended technical adjustments, total reserve reduction required to fund the conversion of 4 contracted positions to permanent state positions and related expenditures would total $173,500 over the 2023-25 biennium. The agency and the governor's finance office concurred to the recommended technical adjustment. So for the decision for the committee today, towards the middle of page 13, does the subcommittee wish to recommend approval of decision units E225, E226, E227, and E228, reserve reductions of $173,500 over the 2023 biennium, including recommended technical adjustments to reduce contractual expenditures by $382,848 over the 2023-25 biennium to fund the conversion of 4 contract positions to full-time positions and associated costs. And B, Decision Unit E229, reserve reductions of $165,635 over the 2023-25 biennium to support 1 new management analyst position and associated costs as recommended by the governor.
Do I have a motion? Or any further questions? Seeing none, do I have a motion?
I motion to approve all items as read by staff.
Do I have a second?
I'll second that.
Any other further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. And then, go ahead.
Tiffany Greenmeyer for the record. At the bottom of page 13, other closing items 1 through 3. Fiscal staff recommends other closing items 1 through 3 be closed as recommended by the governor and requests authority to make other technical adjustments as necessary.
And do I have a motion on that?
I motion to approve closing items 1 through 3 and other items as read by staff.
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Let's move on to 3194.
So moving on to page 17 is the Environmental Health Service budget, 3194. This budget has one major issue, insufficient budget reserve levels and solvency concerns. The executive budget eliminates 4 vacant positions to address reserve levels declining over the 2023-25 biennium. The reserve levels decrease from $710,668 in fiscal year 2023 to $576,062 in fiscal year 2024 and $398,000 to $237 in fiscal year 25. And this includes the elimination of the positions. Moving on to page 18, to maintain the reserve levels in this budget, the governor recommends eliminating 2 vacant positions in the base budget, including 1 full-time environmental health specialist position and 1 part-time administrative assistant position and associated costs. And then also the governor recommends in E226, which would increase the reserves of $357,948 and decrease of $21,337 in federal manufactured food grant revenues over the 2023-25 biennium by eliminating the 2 vacant full-time environmental health specialist position and associated costs is to account for the reduction in county reimbursement revenues due to the establishment of the Central Nevada Health District. And that is to address the loss in revenues. So moving on to page 19. During the hearing, the agency testified and clarified the inadequate revenues were partially due to the restrictions of the pandemic, which reduced the agency's revenue and workload. The agency also indicated that since the pandemic restrictions have been lifted, the agency's workload has begun to recover with the return of the mass gatherings and associated inspections. The agency also testified it is developing a contract to hire a CPA or a accounting firm to perform a fee analysis to address the solvency concerns of this budget. As of March 21st, 2023, a scope of work is being developed. So in summary, the governor recommended budget includes elimination of 4 positions, 2 in the base budget and 2 in the decision unit E226. And just to let the committee know, without elimination of the 2 positions in the base budget, the budget would be negative. So the decision before the committee on the bottom of page 19, there are 2 decisions here. And does the subcommittee wish to recommend approval of the elimination of 1 environmental health specialist position, 1 administrative assistant position, and associated expenditures in the base budget with an offsetting increase to the reserve levels by $109,005 in fiscal year 2024 and $223,297 in fiscal year 2025 to address solvency concerns within the budget? And number 2, does the subcommittee wish to recommend the elimination of 2 environmental health specialist positions and associated expenditures in decision unit E226 with an offsetting increase to reserve levels by $357,948 and reduced federal revenue by $21,337 over the 2023-25 biennium as a result of the workload being taken by the new Central Nevada Health District and as recommended by the governor?
Do we have any questions about that? It looks like we do have a question. Assemblywoman Monroe Moreno.
Thank you, Madam Chair. I just wanted to confirm that all of these positions are currently vacant positions, so there's no one losing a job.
Tiffany Greenmeyer, for the record, yes, the positions are currently vacant.
Any other further questions? At this time, I'd accept a motion.
I motion to approve both items as read by staff.
I'll second that.
Any other further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Moving on to page 20, there are 4 other closing items. Fiscal staff recommends other closing items 1 through 4 be closed as recommended by the governor and requests authority to make other technical adjustments as necessary.
Do I have a motion?
I motion to close items 1 through 4 as read by staff.
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. And now moving on to 3216.
So on page 21 of the closing packet, the healthcare facilities regulation, budget account 3216, there is one major closing item, and it's budgeting the American Rescue Plan Act coronavirus state fiscal recovery funds. The governor recommends $11.4 million in ARPA coronavirus state fiscal recovery funds over the 2023-25 biennium to continue support for the nurse apprenticeship program. Moving on to page 22 of the closing packet, the nurse apprenticeship program approved by the Interim Finance Committee at its February 9th, 2020 meeting is funded with $20.7 million in ARPA coronavirus state fiscal recovery funds. As approved, the nurse apprenticeship program allows nursing students to work up to the scope of training they have received in the school. The average pay is $25 an hour. There are approximately 900 nursing students and approximately 93 facilities that would qualify to access this program. During the hearing, the agency indicated registered nurses and licensed practical nurses are participating in the program, and approximately 44% of the eligible facilities have enrolled. The agency also indicated expanding the type of eligible facilities to include skilled nursing facilities, increase the participation of the nurse apprenticeship program. According to the agency, 210 and 220 students are enrolled as of January 2023 and February 2023, respectively. The agency provided updated projections as of March 24, 2023, indicating the agency intends to expend $4.5 million in fiscal year 2024 and $3.4 million in fiscal year 2025, with a $9.4 million remaining to be redirected as shown in the table. Fiscal staff, moving on to page 23, fiscal staff recommends revisions based on the updated agency projections to reduce the ARPA coronavirus state fiscal recovery funds for the nurse apprenticeship program by $2.4 million in fiscal year 2024 and $1 million in fiscal year 2025, as shown in the adjustment section at the end of the document. The $9.4 million in authority that would remain following actual and projected expenditures would be considered for reallocation to another program and will be considered as a larger discussion around potential savings and allocation of the coronavirus state fiscal recovery funds as part of the COVID-19 relief program's budget closing. The decision for the subcommittee, does the subcommittee wish to recommend approval of the American Rescue Plan Act coronavirus state fiscal recovery funds totaling $4.5 million in fiscal year 2024 and $3.4 million in fiscal year 2025, including the noted revisions based upon the projections provided by the agency to support the nurse apprenticeship program?
Thank you. And I think we have a question from Senator Severs-Gansert.
Thank you, Madam Chair. I appreciate the expansion of the program because it's clear we're not spending down the money and that we're going to have some money in reserves. I happened to have a conversation with Richard Whitley some time ago when we were talking over some of the budgets, and there's another opportunity for something somewhat similar to this, and it's for the clinical time required for Masters in Social Work, the Masters in Social Work program across the state, and he had provided some numbers to me, and maybe he could provide those numbers to the rest of the committee in the near future, because it's another opportunity where we have folks who need to do clinical training, and at the time that they're doing that, they can't work, and so it provides a subsidy like this is to help more people move through the system, and we do something like that for education as well. But I just kind of wanted to mention that, plant some seeds, because it may be money well spent to help us move some more folks through behavioral health programs, specifically social worker type programs. And I don't know if I need to ask Richard to come up to ask if he could provide that information to everyone, just for consideration at a later date.
I think we can call him in at another time. I know we have 20 to get through.
All right. Thank you.
And I agree with you. We do have that $9.4 million now in savings that we'll be able to, I guess, reallocate to programs similar to that.
So thank you.
Does anyone have any other further questions or comments regarding this? Okay, seeing none, I'd entertain a motion at this time.
I motion to support the nurse apprenticeship program as read by staff.
I'll second that.
Any other further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Seeing none, the motion carries.
Sorry about that. There are 8 other closing items. Number 8 is the nursing pools. The governor recommends a reduction in the health facility license and fee revenue totaling $343,048, and a corresponding decrease in the reserves over the 2023-25 biennium due to a proposed change to the definition of nursing pools. Assembly Bill 460 has been introduced to make the necessary statutory changes, which has been referred to the Assembly Committee on Ways and Means. Decision Unit E225, if approved, would be contingent upon passage and approval of an enabling legislation. Fiscal staff recommends other closing items 1 through 7 be closed as recommended by the governor. Other closing item 8 be closed as recommended by the governor, contingent upon passage and approval of AB 460 or other enabling legislation, and requests authority to make technical adjustments as necessary.
Thank you. Do I have a motion?
I motion to approve closing items 1 through 8 as read by staff.
Do I have a second?
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Let's move on to the next one.
Tiffany Greenmeyer for the record. Public Health Preparedness Program, budget account 3218 on page 27 of the closing packet. There are no major closing issues in this budget. So moving on to page 28, there are 8 other closing items. Closing item number 7, Nevada Trauma Registry Software Licensing. The governor recommends funding totaling $167,335, which $94,748 is general funds in fiscal year 2025 to support the Nevada Trauma Registry. According to the agency, the registry expenditures are no longer reimbursable from the Public Health Preparedness Federal Grant, and the intent of the Decision Unit E226 is to replace federal revenue sources with general fund appropriations to maintain the registry. Fiscal staff recommends a technical adjustment to add general fund appropriations of $72,979 in fiscal year 2024 and decrease federal funding by an equal amount. Additionally, fiscal staff recommends fiscal year 2025 technical adjustment to correct the revenues associated expenditures, including a $145,172 decrease to federal revenue and a corresponding net $145,172 decrease to expenditures. While a budget amendment to correct the errors within the executive budget was not submitted, the agency and the governor's finance office concurred with the recommended technical adjustment. Moving on to page 29 is other closing item number 8, which is associated with closing item number 7. So fiscal staff recommends a technical adjustment to remove all general fund appropriations in the base budget, resulting in general fund appropriations decreasing, totaling $129,974 in fiscal year 2024 and $94,338 in fiscal year 2025. Balancing adjustments to increase federal revenue totaling $129,974 in fiscal year 24 and $94,338 in fiscal year 2025 to appropriately align the revenues and expenditures are recommended. The motion for is on page 29. Fiscal staff recommends other closing items 1 through 6 to be closed as recommended by the governor. Other closing items 7 and 8 be closed with the noted technical adjustments and request authority to make other technical adjustments as necessary.
Any other questions? Seeing none, do I have a motion?
I motion to approve all closing items 1 through 8 as read by staff.
Second?
Second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Moving on to 3219.
Okay, moving on to page 31 is budget account health investigations and epidemiology. Budget account 3219. There is one major closing item, and it's the coronavirus state recovery, fiscal recovery funds. There are 2 programs in here. One is recommended by the governor. The recommendation is $2.5 million over the 2023-25 biennium to continue building public health infrastructure through direct support of the public health responses and the development of Nevada public health workforce. The other program that is not in the budget currently is the genomic infectious disease tracking. The agency indicated the infectious disease tracking project has been assigned to the State Public Health Lab, and the $1.5 million in associated ARPA funding provided through and overseen by the Division of Public Health and Behavioral Health would be expended over the 2023-25 biennium. The agency will not expend the ARPA funding totaling $384,925 in fiscal year 2023, as indicated during the hearing. Updated projections indicated by the agency expenditures would total $888,919 in fiscal year 2024 and $606,195 in fiscal year 2025, which are not included in the governor's recommended budget. On the public health infrastructure workforce, during the hearing, the agency indicated public health infrastructure workforce project funding would be expended by awarding $2.5 million in grants in each year of the 2023-25 biennium. The agency indicated a request for proposal is being developed to award funding for healthcare workforce pipeline and anticipate completion by April 2023, with the awards distributed by July 2023. However, according to the updated information provided by the agency, $1.3 million is anticipated to be expended each year of the 2023-25 biennium, with the remaining projected funds projected to be expended in the future biennium of $2.4 million. Currently, a $1.25 million in American Rescue Plan Act coronavirus recovery funding is recommended by the governor in each year of the 2023 biennium. Fiscal staff recommends a corresponding technical adjustment based on the updated agency projections related to the ARPA coronavirus state recovery funds for the genomic infectious disease tracking project and the public health infrastructure workforce pipeline project, totaling $1.6 million over the 2023-25 biennium, as shown in the table below. These adjustments would not result in a net decrease or a net increase in the total obligated funds for these projects, but rather provide more accurate representation for the budgeting of the coronavirus state fiscal recovery funds. So moving on to page 33 is the decision for the subcommittee. Does the subcommittee wish to recommend approval of the American Rescue Plan Act coronavirus state fiscal recovery funds totaling $2.2 million in fiscal year 2024 and $1.9 million in fiscal year 2025, including the technical adjustments as noted to support the genomic infectious disease tracking project and the public health infrastructure workforce pipeline project?
Do I have any questions from the committee? Seeing none, I'd entertain a motion at this time.
I motion to approve support of the Genomic Infectious Disease Tracking Project and the Public Health Infrastructure Workshop Pipeline Project as read by staff.
I'll second.
Having a motion and a second, any other further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries unanimously.
Continuing on page 33 are 9 other closing items. Closing items 7, 8, and 9 are fiscal staff requests technical adjustments to align revenues and expenditures. Fiscal staff recommends other closing item 1 through 6 be closed as recommended by the governor. Other closing items 7 through 9 be closed with the noted technical adjustments and request authority to make other technical adjustments as necessary.
Any questions? Seeing none, do I have a motion?
A motion to approve all items as read by staff.
Do I have a second?
Second.
Second. Seeing no further discussion, all those in favor say aye. Aye. All those opposed say nay. Motion carries unanimously. Moving on to 3220.
On page 37, 3220 is chronic disease. There's one major closing issue in this budget, Fund for Healthy Nevada funding reduction. The governor recommends $1.1 million in Fund for Healthy Nevada funds transferred from the Office of the State Treasurer to support the food security and tobacco cessation programs each year of the 2023-25 biennium. The governor also recommends $17,378 in Healthy Nevada funds transferred from the Department of Health and Human Services, Director's Office Grants Management Unit to support the oral health program over the 2023-25 biennium. Moving on to page 38. During the hearing, the food security program was established to improve the quality of life and health of Nevadans by increasing food security throughout the state. The division supports the Office of Food Security, which is funded through an allocation of Healthy Nevada funds. The governor recommended budget includes $118,382 of the $4.3 million in Healthy Nevada funds allocated to the chronic disease budget. The oral health program consists of the contract staff, dental health hygienist, and the associated costs, and is funded through the Wellness Family Services Program, which is Healthy Nevada funds, which is transferred from the Director's Office Grants Management Unit. As the budget was submitted, the recommendation includes $17,378 of the $180,180 allocated over the 2023-25 biennium for the oral health. During the hearing, hearing for this budget, the agency stated it would work with the Governor's Finance Office on a budget amendment to align the Healthy Nevada funding allocations and associated expenditures for the food security, tobacco cessation, and the oral health programs with the Healthy Nevada spending plan. On March 7th, 2023, the Governor's Finance Office submitted a budget amendment A2314132220 to increase Healthy Nevada funding allocations for the food security program by $1.1 million in each year of the 2023-25 biennium, and the oral health program by $129,633 in fiscal year 2024 and $129,654 in fiscal year 2025. The budget amendment as submitted, however, did not include the entire allocation to the chronic disease budget per the Healthy Nevada's funds spending plan. In subsequent correspondence, the Governor's Finance Office indicated a revised budget amendment would not be submitted and directed the agency to work with the fiscal staff to correct the allocation. Fiscal staff recommends a technical correction totaling $1 million in Healthy Nevada funds each year of the 2023-25 biennium to align Revenue and Expenditure Authority for the Food Security Program, and $60,030 in fiscal year 2024 and $58,352 in fiscal year 2025 in Healthy Nevada funds to correct the expenditure authority for the tobacco cessation program per the Healthy Nevada spending plan. To summarize, in addition to the Healthy Nevada funds recommended in the budget amendment, A2314132220, fiscal staff recommends a technical adjustment correction to increase Healthy Nevada funds by the $1.1 million in each year of the 2023 biennium, as shown in the table below. Moving on to page 39 is the decision for the subcommittee. Does the subcommittee wish to recommend approval of $3.4 million in Healthy Nevada Fund revenue transferred from the state treasurer and the grants management unit budget, associated expenditures in each year of the 2023-25 biennium, inclusive of a budget amendment A2314132220, and recommended technical corrections to align the Healthy Nevada funds spending plan as noted.
And just for clarification, it sounds like initially the first recommended budget was considerably less than what this has normally stood at. And with the amendment, we still didn't get to fully funding the Healthy Nevada funds. And so with this correction, we are now back up at what we have traditionally been funding this agency at. Is that correct?
Yes, that's correct.
Okay. Do we have any other further questions? At this time, I'd entertain a motion.
I motion to approve all items as read by staff.
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Moving on to page 39 is other closing items 1 through 5, and page 40. Other closing item number 5, fiscal staff recommends a technical adjustment of $154,061 over the 2023-25 biennium to reduce the Wise Woman Grant Revenue Authority and eliminate the contract position expenditure retained in the budget to offset the state full-time position. So this is a conversion of a contract position to a full-time position.
Do I have a motion?
I motion to approve other closing items 1 through 5 as read by staff.
I'll second that.
Any further? Oh, It looks like we skipped something as well, so we're going to go back. But do we have any? Yeah, let's rescind that. Can I ask you to rescind that second and that first?
I rescind the first.
Are we good?
I think you're good on the other closing items. We just had to go circle back.
Go back, okay.
Sorry.
Never mind, just ignore me. Do we have any further discussion on the motion on the floor right now? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Okay, that motion carries. And if we can just circle back.
Tiffany Greenmeyer for the record. Sorry about that. So circling back to page 39 is the coronavirus state fiscal recovery funds. There is just one program here. Does the subcommittee wish to recommend approval of $375,000 in American Rescue Plan Act coronavirus state fiscal recovery funds over the 2023-25 biennium as recommended by the governor?
Do I have another motion?
I will motion again to approve all items as read by staff.
I'll second that.
Thank you. Seeing no further discussion, all those in favor say aye. Aye. All those opposed say nay. Motion carries. Now we can move on to the next budget, 3223.
Tiffany Greenmeyer for the record. Moving on to page 41, Office of Health Administration, budget account 3223. There is two major closing items in this budget. The first major closing item is the request for 4 new full-time positions for information technology and human resources. The governor recommends an addition of 4 new full-time positions and associated costs, including 3 information IT professional positions and 1 personnel analyst. The recommendation is funded with reserve reductions totaling $197,589 and cost allocation charges of $600,473 over the 23-25 biennium. The one new IT position would support and assist the administration of the IT security and email tools. Moving on to page 42 is the request is for 2 IT professional positions, E241. This would provide support for the Division of Public Health, Behavioral Health's technology systems and applications. The next position is personnel analyst position, which is E242, which this would provide support for quality assurance and investigations for the division. So at the bottom, the decision for the subcommittee on page 42, the decision for the subcommittee wished to recommend approval of decision unit E230, $160,354 in cost allocation charges and $53,283 in reserve reductions over the 2023-25 biennium to support 1 full-time information technology professional position and associated costs. B is decision unit E241, $319,952 in cost allocation charges and $106,328 in reserve reductions over the 23-25 biennium to support 2 full-time information technology professional positions and associated costs. And C, decision unit E242, $120,167 in cost allocation charges and $37,978 in reserve reductions over the 2023-25 biennium to support 1 full-time personnel analyst position and associated costs.
Thank you. Any other questions? Seeing none, I accept a motion at this time.
I motion to approve decision unit E230, decision unit E241, and a decision unit E242 as read by staff.
And I will second.
Any further discussion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. No. Mary, motion carries. If we can move on to the next one.
Okay, great. Moving on to page 43 is the second major closing item, which is funding of new information technology and data security software. The decision for the subcommittee: does the subcommittee wish to recommend approval of decision units E244, E245, and E247, the purchase of the IT and data security software with the noted technical adjustments to replace general fund appropriations with cost allocation reimbursement revenue totaling $437,692 in cost allocation reimbursement revenue over the 2023-25 biennium.
Do I have any questions? Seeing none, I'll entertain a motion.
I motion to approve decision units E244, E245, and E247 as read by staff.
I'll
Do I have a
second.
Having a motion and a second. Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Let's move on to the next decisions.
Okay, moving on to page 44, the coronavirus state fiscal recovery funds. There are 5 ARPA programs, of which 4 would continue in the 23-25 biennium. I am going to read item number 8. This is a transfer, E900. The governor recommends transferring $8.3 million in ARPA coronavirus state recovery funds to the new public health improvements budget to provide subawards to the local public health agencies to support staffing and infrastructure needs. Fiscal staff does recommend a revision to the based on updated agency projections to increase the ARPA funding in the base budget and in the decision unit E900 for the transfer to the new public health improvements budget by $7.8 million in fiscal year 2024 and $1 million in fiscal year 2025, totaling $17.1 million over the 2023-25 biennium. The decision before you is on page 45. Does the subcommittee wish to recommend approval of A, base and decision unit E900, base revenue authority and transfer authority totaling $17.1 million in ARPA coronavirus state fiscal recovery funds over the 2023-25 biennium for transfer to the new public health improvements budget to subaward to local public health agencies, including the noted revisions. B, base, $547,293 in ARPA coronavirus state fiscal recovery funds over the 2023-25 biennium to support 3 full-time positions, 1 part-time contract position, and associated expenditures as recommended by the governor. Item C, decision unit E226. $1.7 million in ARPA coronavirus state fiscal recovery funds over the 2023-25 biennium to support 10 intermittent positions and associated expenditures as recommended by the governor. And decision unit E807, $39,869 in ARPA coronavirus state fiscal recovery funds over the 2023-25 biennium to support the reclassification of 1 management analyst position as recommended by the governor.
Do we have any questions regarding this? Seeing none, I'd entertain a motion.
I motion to approve all items as read by staff.
I'll second.
And seeing no further discussion, all those in favor say aye. Aye. Anyone opposed say nay. It carries. Moving on to the next one.
Moving on to page 46, other closing items 1 through 8. 8 has a technical correction to include grant funding and associated expenditures. As approved at the Interim Finance Committee, which was approved in the January IFC meeting 2023, January 31st, 2023 meeting, was the Centers for Disease Control and Prevention Strengthening and Sustaining Nevada's Public Health Infrastructure Grant. Fiscal staff recommends a technical adjustment totaling $2.4 million in fiscal year 2024 and $2.6 million in fiscal year 2025. And that would support the 6 positions that were approved in that work program. Fiscal staff recommends other closing items 1 through 7 be closed as recommended by the governor. Other closing items 8 be closed with the noted technical adjustment and requests authority to make other technical adjustments as necessary.
And just for clarification, this was decided during the January 2023 IFC meeting, and by doing this here in the budget, we would avoid having to come back for the work program. Is that correct?
Yes, that is correct.
Okay. With that, any other questions? Seeing none, I'd entertain a motion.
I motion to approve all items as read by staff.
I'll second.
Seeing no further discussion, all those in favor say aye. Aye. Anyone opposed say nay. Okay, motion carries. And I think we are moving on now to Budget 3224.
Moving on to page 49, budget account 3224. This budget has one major issue, over budgeting of county assessment fees. The executive budget overstates the projected amount of fee revenue available by $290,571 in fiscal year 2024 and $294,881 in fiscal year 2025 when compared to the agency projections. Moving on to page 50, during the hearing, the agency confirmed the county assessment fee revenue projections would total $401,094 in each year of the 23-25 biennium due to a decrease in county participation revenue resulting from the 4 counties that make up the Central Nevada Health District. And they will, with that, the public and behavioral health will no longer provide services, so they will no longer receive those revenues. So because the governor's budget overstates projected county assessment fee revenue, fiscal staff developed 2 options for the subcommittee to consider today. And I'll just go right into the options. The decision on page 51 for the subcommittee is to recommend approval of A, decreased county assessment participation fee revenue of $585,452, increased federal revenue totaling $265,044, increased general fund appropriations totaling $195,269, and decreased expenditure authority totaling $125,139 over the 23-25 biennium to align revenue and expenditure authority as a result of over-budgeted county assessment fee revenue. Or B, decrease county assessment participation fee revenue of $585,452, increase federal funding of $250,719, and decrease expenditure authority of $125,139, and the elimination of 2 vacant full-time administrative assistant positions and associated expenditures, resulting in the savings totaling of $209,594 over the 2023-25 biennium to align revenue and expenditure authority as a result of over-budgeted county assessment participation fee revenue.
And my question, and I don't know who can answer this question, so it's my understanding that if we were to eliminate these 2 positions, the impact would be on the community nurses that would have to, I guess, do even more administrative work. Is that my understanding?
Tiffany Greenmeyer for the record. Yes, that is correct, according to the agency.
Okay, thank you. I saw someone moving up. It sounds like that's correct. Do we have any other further discussions regarding this matter? No. At this time, I'd entertain a motion on one of these options.
I motion to approve option A, decrease county assessment participation fee revenue of $585,452, increased federal revenue totaling $265,044, increased general fund appropriations totaling $195,269, and decreased expenditure authority totaling $125,139 over the 23-25 biennium to align revenue and expenditure authority as a result of over-budgeted county assessment participation fee revenue.
And I'll second that.
Do I have any discussion on the motion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Moving on to page 52 is the Coronavirus State Fiscal Recovery Funds. A decision for the subcommittee. Does the subcommittee wish to recommend approval of the $3.3 million in American Rescue Plan Act Coronavirus State Fiscal Recovery Funds over the 2023-25 biennium to support reproductive health programs as recommended by the governor?
And do I have a motion on that?
A motion to approve support for the reproductive health programs as stated by staff.
And I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries.
Moving on to the bottom of page 52, there are 5 other closing items. Items number 4 and 5. Fiscal staff recommends not to approve E490 as the family planning grant was awarded just recently. And so we would not need to eliminate the family planning grant at this point. And then item number 5, increase, if fiscal staff recommends not approving E225. So fiscal staff recommends other items 1 through 3 be closed as recommended by the governor. Other closing items 4 and 5 not be approved, and request authority to make other technical adjustments as necessary.
Do you have any other questions regarding that? Seeing none, I'd entertain a motion.
I motion to approve items 1 through 3 and not approve 4 through 5 as read by staff.
I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. And we are moving on to 3234.
So moving on to page 55, public health improvements, budget account 3234. This is a new budget. Public health improvements is recommended to establish to account for revenues and expenditures for public health systems program funded through the Federal American Rescue Plan Act, Coronavirus State Fiscal Recovery dollars. The governor recommends a new budget to account for the revenues and expenditures for the Public Health Systems Program. The recommendation includes $8.3 million in ARPA Coronavirus State Fiscal Recovery Revenue and Expenditure Authority over the 2023-25 biennium. Due to the agency providing updated projections, fiscal staff recommends a revision to the governor's recommended budget based on the updated agency projections, which would increase the ARPA Coronavirus State Fiscal Recovery Funds for the Public Health System Program by $7.8 million in fiscal year 2024 and $980,000 in fiscal year 2025. As shown at the bottom of page, there's a table at the bottom of page 56. Fiscal staff would note with the FY 2023 projected amount and the updated FY 2024 and 2025 amounts, the full $20.8 million would be reflective in the legislative approved budget, if approved. The decision before you is on page 57. Does the subcommittee wish to recommend approval of American Rescue Plan Act Coronavirus State Fiscal Recovery Funds transferred from the Office of Health Administration budget totaling $14 million in fiscal year 2024 and $3.1 million in fiscal year 2025, inclusive of the noted revisions based upon updated agency projections to support the public health system program? Fiscal staff requests authority for staff to make technical adjustments as necessary.
Any questions regarding that? Seeing none, I'd entertain a motion.
I motion to approve support of the public health system program and allow fiscal staff to make necessary technical adjustments.
And I'll second that.
Any further discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say nay. Motion carries. Moving on to the next. Item 3235.
Moving on to page 59 is budget account 3235, emergency medical services. There are no major closing items in this budget. Other closing items 1 through 7. 7 is to balance forward licensing fees, which this decision unit, if approved, would be contingent upon passage and approval of an enabling legislation. Fiscal staff recommends other closing items 1 through 6 be closed as recommended by the governor, and other closing item 7 be closed contingent upon the passage and approval of an enabling legislation, and requests authority for staff to make technical adjustments as necessary.
Thank you. Do I have a motion?
I motion to approve all items as read by staff.
And I second.
Any further discussion? Seeing none, all those in favor say aye. Aye. Any opposed, say nay. No? Okay, motion carries. If we could take a 1-minute recess. Okay, I'm bringing us back into the meeting. Thank you for that brief recess so we could clarify. Before we get started, I know we have budgets 3101, 3152, 3213, 3214, 3215, 3217, 3222, and 4547. And there aren't really any issues. So with that, I'm going to turn this over to staff to highlight. There are a couple technical adjustments, and we'll put those on the record. And we'll give her a moment to get situated. Thank you.
Yes, there are 8 budgets that are staff closing. Staff is responsible for developing recommendations for these budgets. The subcommittee has not previously reviewed these budgets. 4 of the budgets have technical adjustments, and there's one budget that has a budget amendment, and I will address those. Budget account 3213 on page 65, immunization program, has a technical adjustment. Fiscal staff recommends a technical adjustment to M201, which reflects the caseload projections provided by the agency totaling $103,711 in additional general fund appropriations and $1.6 million in federal Title 21. Revenue transferred from the Division of Health and Care, Finance, and Policy over the 2023-25 biennium, as shown in the following table. The other item, number 5, is a budget amendment, A231463-213. The governor recommends a budget amendment to increase IZ cocooning project authority by $268,666, fund it with equal amount of general fund appropriations over the 2023 biennium, 2023-25 biennium. Also, item number 6 is Appropriations Act language. The governor recommends language in the 2023 Appropriations Act, providing that the sums appropriated in the immunization program are available for both fiscal years of the biennium and may be transferred from one fiscal year to the other with the approval of the Interim Finance Committee upon recommendation of the governor. Moving on to the communicable disease budget, which is 3215. There are other closing items 1 through 5. Number 5 is a technical adjustment to align revenues and expenditures. Moving on to page 73, budget account 3217, healthcare facility administration penalty, which other closing item number 2 is it's a technical adjustment to align revenues and expenditures. And then moving on to page 75 is 3222, maternal, child, and adolescent health services. And on page 76, there is the Appropriations Act. The governor recommends language in the 2023 Appropriations Act, providing that the sum appropriated to the maternal, child, and adolescent health service budget are available for both fiscal years of the biennium and may be transferred from one fiscal year to the other with approval of the interim finance committee. And then, moving on to page 79, budget account 4547, marijuana health registry. There is a technical adjustment to correct the reserves. And for the, moving on to the last page, page 81 is the summary, and I will read this really quick. Fiscal staff recommends that the following budgets be closed as recommended by the governor and requests authority for staff to make technical adjustments as necessary. Budget account 101-3101, DPPH radiation control, 251-3152, DPPH low-level radioactive waste fund, 101-3213, DPPH immunization program, with the other closing item 4 closed with the noted technical adjustments to update caseload, and other closing item 5, including budget amendment A2314632213 to add general fund appropriations to increase funding for the IZ cocooning project. 101-3214, DPPH WIC food supplement, 101-3215, DPPH communicable disease and other closing item 5, closed with the noted technical adjustment to align revenue and expenditure authority. 101-3217, DPPH health care facilities administration penalty, with the other closing item 2 closed with the noted technical adjustments to align expenditures in a special use category. 101-3222, DPPH maternal, child, and adolescent health services, and 101-4547, DPPH marijuana health registry, with other closing items, with item 6 closed with the noted technical adjustment to align balance forward and revenue reserve totals. That's it.
Thank you for that. Do we have any other questions about that? Seeing none, I'd entertain a motion at this time.
I motion to close budgets as stated by staff and to make technical adjustments as necessary.
And I will second.
Any discussion? Seeing none, all those in favor say aye. Aye. Anyone opposed say no. Nay? Oh man, it is one of those days. Anyway, well, thank you guys all so much. That motion passes. And with that, I think we have gone through everything. One second here. Just want to thank our staff. Tiffany, that was her very first budget closing, so she did a great job. I know that everyone works so hard. Yes. Especially on this particular subcommittee, there are a lot of budgets, so I'm very appreciative of her and her first time. I honestly did not know that, and so I think she did a great job. So I just wanted to say that. I will close the budget closings, that part of the agenda, and move on to public comment, and ask anyone. I don't see anyone running to the table here in Carson City or in Las Vegas. BPS, is there anyone on the line? Again, I'd remind callers to please state your name and limit your testimony to 2 minutes.
We have no callers for public comment at this time.
Thank you. And with that, I will close public comment and I will adjourn this meeting. Thank you, guys.
Happy Easter weekend, everyone.